Good morning and welcome to our Monday morning COVID-19 briefing. My name is Megan Pearson. I'm the Chief Communications Officer, and today I have with us Ryan Alsop, our Chief Administrative Officer, Matt Constantine, our Director of Public Health, and Kim Hernandez, our Lead Epidemiologist. Our report today is very brief, so I'm going to give you some numbers, and then I'll have Ryan speak briefly. Right now, we are reporting 124 new cases and 0 new deaths. Our state-funded testing sites remain open. They are in Arvin, the Kern County Fairgrounds, Wasco, and Rosamond. The county also has locations open in Oildale, Taft, Delano, Kern River Valley, Ridgecrest, Tehachapi, and Lamont. Their hours are as stated on the website, no changes currently, although we do expect a couple of them to change, so make sure you're checking back. That information is available on kerncounty.com at the COVID-19 testing site. With that, I'm going to bring up our Chief Administrative Officer, Ryan Alsop.
Thanks, Megan. Good morning, everybody. As Megan said earlier, we have the full team here ready to answer any of your questions that you have. As many of you that have questions, we'll take all your questions, try to answer them all, take our time doing that today. But quickly, we've tested about 73,000 residents as of today for COVID. 66,000 of those tests, or 92%, have been negative. We're seeking the results of about 730 residents, or 1% of those total tested, and we've got 5,369 residents, or about 7% of that total, who have tested positive. Of the 5,369 residents who have tested positive, 5,165, or 96%, are either fully recovered or are isolated and recovering at home, treating their symptoms on their own. Again, this percentage has been consistent on a daily basis, this 96% on a daily basis from the beginning. Today, 123 residents are receiving some sort of care in an area hospital for COVID. That's about 2% of the total number tested, and we've got 82 folks, about 2% of those tested, who have unfortunately passed away. On the state's public health monitoring program for counties, there are 3 main epidemiologic categories that the state is watching and monitoring counties for. On testing positivity rate, this is a 7-day average with a 7-day lag. Kern County is at 4%. The goal that the state has for counties is 8%, so we're below that goal. The case rate per 100,000 people over a 14-day period here in Kern County is 70.7. The state's goal is to be below 100. We are below that particular goal. And the percentage change in the 3-day average of hospitalized patients, Kern County today is at 18, nearly 18.5%. The state target is to be below 10%, so we are trending above that goal, again, on numbers of hospitalized patients. Quick update on the Kern Recovers program. This is our forgivable loan program. $13.5 million in funding has gone out to 509 businesses across 184 different industries here in Kern County. Average loan is about $25,000, and it's typically taking about 15 days from time of application to time of funding. We would ask all of those businesses who have either been essential or non-essential under the governor's orders for the past several months, and in addition to those businesses who have received PPE in the following categories. If you're a dine-in restaurant or a winery or a tasting room, movie theater, a family entertainment center, these are bowling alleys, miniature golf, batting cages, arcades, etc., zoos, museums, card rooms, things like that. If you have received PPP, which is the federal money from the Federal Assistance Program previously, we are now taking your applications to receive a stimulus that's being provided by the county through the Federal CARES Act. Information on this can be found at kerncounty.gov countyhealthdepartment.com, right there at the front, at the homepage. And finally, the county is distributing personal protective equipment, or PPE, to small businesses in our county that you can get a 2-week supply at no cost to you. These are masks, gloves, sanitation equipment, hand sanitizer, et cetera. You can get information and apply to receive that PPE at kerncounty.com, kerncounty.com. With that, we're happy to answer any questions you have.
Thank you, Ryan. We'll go in our typical order down the list. Remember, it is *6 to unmute. And our first outlet is Kern Radio. Anyone on the line?
Hello, J.R. Flores, Kern Radio.
Go ahead.
Yeah, my question is about hospitalizations. I was wondering, what are some of the complications brought on by the coronavirus that we're seeing in the local hospitalized patients? Are we seeing pneumonia? Are we seeing heart conditions? What other complications due to coronavirus are we seeing and dealing with in the hospitals?
Chair, we're going to have Kim Hernandez respond to your question.
Hi, one of the most common complications we do see is, of course, that shortness of breath, which may develop into pneumonia and other respiratory issues. We can't speak individually on patients. You know, if you want to know exactly what our hospitals are saying, you'd have to go and speak with the hospitals. But we do know that there are a number of complications that cause people to be hospitalized. And one of the big ones is the difficulty breathing and the need for oxygen support.
All right, follow-up question. What's the discrepancy in the state reporting in hospitalizations versus the county? I see over 200 on the state site, but you guys are reporting just over 120 this morning.
That's another Kim question. We'll have her respond.
As we've mentioned before, the state is reporting numbers based on patients who are hospitalized. On the Kern County Public Health dashboard, we are reporting the number of hospitalized patients who are still isolated while in the hospital. So those two are not necessarily the same thing, but we are looking from a public health perspective of people who are potentially infectious, while the state report from hospitals is looking at the number of beds available in the hospital.
So it's safe to say that if somebody is recovering, what you guys call recovering at home, if they're recovering at home and develop pneumonia during their recovery and are brought to the hospital, are they listed as a pneumonia patient or a COVID patient? And is that where the discrepancy is coming from?
So on the dashboard, if a patient is in the recovered category, they would be a patient who is no longer infectious and not a public health concern in our community. If that person develops secondary symptoms or was hospitalized for another reason, they would not show up in our dashboard as a patient who is isolated in the hospital because they are no longer in isolation. However, as you mentioned, they may show up in the state's report as a patient who is hospitalized.
And when it comes to death, if they die due to the complication of pneumonia brought on by the coronavirus, is that listed as a coronavirus death or pneumonia?
So the deaths are determined based on what the medical provider writes on the death certificate. So if the medical provider determined that this patient did die of COVID-19 and entered that on the death certificate, they would be counted as a COVID-19 death.
Thank you, Kim. Our next outlet is Channel 23. Anyone on the line with questions?
Walker with 23.
Go ahead.
I was just wondering, have you guys been in contact with the state strike team? Public health?
So we have not.
Okay, and are there any updates on the skilled nursing facilities?
We'll have Matt respond to that.
Good morning. So we continue to regularly manage our local skilled nursing facilities. Georgiana Armstrong, the one that the Board of Supervisors appointed as our skilled nursing facilities accountability officer, remains intimately involved Our EMS staff within public health remains involved. Our testing team, where we're actually testing employees, is finishing up their involvement. We were on phone calls this morning with the state about skilled nursing facilities. So this is an ongoing effort. It's dynamic. I don't have anything more to report out on specific numbers. I'll wait till Thursday to let Georgiana give us an update on her efforts and the county's efforts. But this continues to be an issue locally. As you can see from the state's website, the cumulative numbers continues to increase with some of our skilled nursing facilities. So this remains a concern to us, and we are actively attempting to manage it. I don't have more specifics than that. Do you have any more questions?
I know you guys were wanting more involvement from the state. Have you been receiving that?
So we've been asking the state to play more of a role locally, and yes, they have been responding. Again, we were on a call this morning with the state trying to determine the current status of some of the skilled nursing facilities. They are responding. We're hopeful that that level of commitment remains. We believe that there still are some areas of weakness that we want to improve, but yes, we're working collectively to try to address some of those concerns.
And lastly, what were those areas of weaknesses that you guys want to see more?
So there's a couple of fundamental issues. Infection control continues to be a concern to us. Obviously, with numbers increasing, infection control is not adequate. We need to address that. Some of the data gathering and reporting is still not perfect. We want that to be reinforced by the state so that the skilled nursing facilities are reporting accurate numbers to the state on a daily basis so we can track and find early indications of any outbreaks. And testing, on-site testing needs to continue. Since the county has completed or is about to complete our testing of every single skilled nursing facility, there needs to be ongoing serial testing done at these facilities as required by the state. But the facility itself needs to develop that plan and deploy that plan now. So that's another area of weakness that we're still trying to work through. Any other questions?
Okay. No, I'm good. Thank you.
Our next outlet is Kern Soul. Anyone on the line with questions?
Hi, this is Elizabeth with Kern County News.
Hi, go
My
ahead.
question is about hospitalizations. How many of the 123 people being isolated in the hospital are ICU patients?
Elizabeth, I think we're trying to find the data on that. If you'll give us 1 second.
Okay, thank you.
Let me go. Elizabeth, do you have any other questions that we can go to while we find the data on that one? If not,
That's
we'll just
my
go
only
to the
one.
next
You
caller and
can
come
come
back.
back.
Okay.
Okay.
So our
Thank
next
you.
outlet, Mojave Desert News. Anyone on the line? Channel 29. Anyone on the line?
Hi, this is Tyra Majors from Channel 29. My question also has to do with the state. A couple counties in California are citing people for not wearing masks, and I was wondering if you guys are in talks with the state about requiring people to wear masks and what the guidance is from the state. Also, for about a week now, Governor Newsom says he may be withholding funding from counties who don't apply with certain health orders. Are these things that we might see happening in Kern County in the near future?
Tyra, we're going to have Matt respond to that.
Tyra, good morning. So as you probably have seen, there's been, the governor has developed a strike team that is to address enforcement within the counties. What we have been doing has been consistent to try to encourage everybody to comply, specifically to masking, also to ask people to take that extra step so that you protect others. Oftentimes, you may not choose to wear a mask, but you may be exposing somebody else, and that other person that you're exposing could be could have a weakened immune system or could be caring for somebody at home that's older or somebody that's otherwise ill that is more susceptible to COVID-19. So we're trying to really reinforce the need for people to adhere to those guidance documents. I think the approach that we're taking, holding regular press conferences, getting out PSAs, posting information online, sending information to our businesses is an appropriate level of response. And I think the state will be satisfied with our approach. I think, as we've seen, the state has that team of different agencies that will respond to areas that need additional help. And I think collectively, the approach should work. In Kern County, we do a really good job at listening to that guidance, and our businesses are doing well at implementing all those different components of those guidance documents.
All right, thank you.
Thank you.
Elizabeth, I think we have the answer to your question, so we're going to have Kim respond to that now.
So while we haven't released the number of, we don't report out on the number of ICU patients who are isolated, we do have from state numbers that there are 67 COVID patients in Kern County ICUs.
Thank you. And Tyra, did you have any follow-up questions? I'm sorry.
Question regarding the state. Matt just said that the state is feeling satisfied with the way the county has approached everything that's going on. If they feel satisfied, why have we had to scale back reopening certain businesses here in Kern County?
We'll have Matt come respond.
So good morning. So from what we've been told, our level of response, I believe, is adequate. I think the question was on encouraging compliance with the state to close certain industries because of the rising numbers. So although I should ask for clarification, I'm thinking these are two different responses to your question. Could you perhaps restate the question if I didn't answer it right?
Yes. So Governor Newsom saying that he may have to withhold funding from certain counties who don't comply with orders. That's separate. That's for businesses, but also just guidance from the state. You said that Kern County has been doing pretty well with complying with orders, but we are seeing that Kern County is one of the counties that have had to kind of scale back on reopening, such as restaurants even only offering the outdoor dining now instead of indoor dining. That's one example.
So what was the question?
Is that more clear?
Well, what was the question specifically then?
Why has Kern County had to scale back on their reopening?
Well, the answer to that,
If you feel that the state is satisfied?
so the answer to that is, I think the state is using the monitoring list as an indicator of their level of concern. And that monitoring list has indicated that for the last more than 2 weeks, I think almost 3 weeks now, we've been on that list, not meeting that certain criteria that they've established. Based on that, the state then has required those counties, I think there are 19 counties in the state representing more than 70% of the population, that are not meeting the state monitoring metrics, and therefore they've asked those counties to scale back on some of those businesses that were allowed to open. So I think we have been responsive to those requests. I think you'll see many people when you go out wearing masks, doing the best that they can. However, some of those metrics we're still not meeting. And as we've stated before, we're concerned about how this impacts our hospitals and our ICU beds. So it is a good indicator that we need to do more. It's clearly not enough, and there's some challenges ahead of us. So I'm hopeful that answers your question.
That did. Thank you so much for the metrics. And Since you just mentioned the ICU beds, do we have any updates on hospital beds at the moment?
We do not.
All right, thank you.
Our next outlet is Channel 17. Anyone on the line?
Hey everybody, Aton Wallace here. While we're talking about metrics, I just want to stay on that for a moment. Brian mentioned the percentage change in 3-day average of hospitalization patients. Today, Kern is 18%. State's target is to be below 10%. What does this mean for the hospitals? And could the state take any action as far as you know? Is there any concern about that to lower this rate here in Kern County?
Hey, Tom, we're going to have Ryan respond to that. Hang on one second.
Mm-hmm.
Hi, good morning, Eitan. The state did and has responded to that by rolling back, at least for the next 3 weeks, certain industries here in Kern County, along with 17 other counties that represent, as Matt said, over 70% of the state's population. So the hospitalization epidemiological, category that they have in their it's 4 or 5 sets of data. That particular parameter is problematic up and down the state in many counties. So we're continuing to watch that, but the state has acted. That's really the one area where we're exceeding the state's requirement. And that got us on this monitoring list. We've been on the monitoring list under that particular category. There have been other times when we've been over in other areas, but we're back under. That's really the category that's keeping us on this monitoring list. So state has acted. He's rolled back. Governor's rolled back activity in certain areas, and that is the position that we find ourselves in, at least for the next 3 weeks, as we continue to monitor across several parameters.
And thank you, Ryan. As far as you know, has the state indicated to you or the 17 other counties if the stats continue as they look right now with that specific criteria, would they go ahead and extend that 3 weeks longer?
Hang on, Eitan. We'll have Ryan respond.
Thank you.
Yeah, so it's 19 counties total. We're one, and so it's 18 others. I incorrectly said 17. It's entirely possible. So in 3 weeks, who knows what the administration will say. I suspect that once we get 3 weeks into this, we take another look at the data, and the state will make a determination on who may resume reopening with adaptations and under guidelines, and who may not. And I think it's entirely possible that this will get extended even further than the next 3 weeks, depending on how we are doing in each of those categories, how we are doing as a community, as a region, as a state, on flattening and the curve and managing the spread of this virus. I think it will have a lot to do with our hospital availability at the end of the day. Again, that's what we keep talking about. And I hope that answers your question, Eitan.
Thank you, Ryan. And just to follow up with something Dr. Lyon talked about at the last press conference, any update on staffing for hospitalizations?
We'll have Matt respond.
Eitan, good morning. I don't have specific updates beyond to say that staffing remains one of our top concerns. We have been reporting to the state on our bed availability and our ICU bed availability, but locally we remain concerned about staffing specifically of our ICU beds. Obviously, nurses are critical to our response and our ability to provide care especially in an ICU. So this is something that we are monitoring closely. We're staying in contact with the hospitals. We are exploring options on how we can increase staffing locally. We're looking at all options today, but as it stands now, I don't have a specific update, Eitan, just to say that this remains one of our concerns that we're tracking really closely.
Much appreciated. Thank you.
Our next outlet is KNZR. Anyone on the line?
This is Tony at KNZR. I guess I'm curious about the way this whole thing about wearing masks is going to be enforced, if you will, because we've gone through this before with seat belts when people tried to find every way they could to not wear a seatbelt once that was mandated, and there were several changes that happened to make it against the law, and the same thing with smoking in various establishments. Are we going to see the same thing happening here with the wearing of the mask, that there will have to be some kind of law enforcement involvement in order to get people to wear them?
We'll have Ryan respond, Tony.
No, I don't think so. I was out and about this weekend, as I'm sure other people were. I remember going to Costco. Went to another grocery store. Every single person that I saw was wearing a mask. In fact, those particular businesses that I visited this weekend had signage that were asking folks to wear masks to come in. I didn't see anybody that didn't have a mask on. I think our community is responding well. I think people are, in fact, wearing masks when they are not able to distance and they are forced to be around other people, particularly people that they're not familiar with, that are not part of their household. I think that the county, in large measure, is doing a good job. We're going to continue to reinforce the state directives of all counties up and down the state. There are numerous adaptations, guidance documents, recommendations, orders. We're making sure that everybody understands what those directives are. We're certainly making sure that our area businesses, particularly those industries that are targeted specifically in any one way or another by the Newsom administration, we're making sure that they understand what they ought to be doing right now. So continuing to reinforce, lots of communication. Our community's doing a good job. We need to continue down that path. It's not just masks, but it's hand washing, distancing, staying away from others if you're sick, et cetera.
Mm-hmm. And also I'm wondering if the skilled nursing centers, there was a report that came out some weeks ago that the state was actually sending COVID patients to some of these nursing facilities, and that may have helped increase the number of infections that were found in those organizations. Is that still going on, or have they come up with a different way to handle that?
We're going to have Matt try and respond to your question, Tony.
Tony, good morning. I'm not understanding the question. You said the state was sending COVID-positive patients. Could you help me understand that?
Well, there was a report that I read that the state was sending COVID-positive patients to nursing homes. And that was something that has not been talked about very much, but I wanted to know if you had that same information, and is that still current?
No, sir. I'm not aware of the state actually sending COVID-positive patients to a skilled nursing facility. I'd probably like to understand more about what state agency, but obviously anything that influences how our local skilled nursing facilities operate, and especially if there are COVID-positive patients coming in, that would clearly be an area of interest for us, but I'm not aware, Tony.
Thank you. Okay, thank you.
Okay, and our final outlet is the Bakersfield Californian. Anyone on the line?
Hi, yes, this is Stacy. I have actually two questions I hope I can ask. My first one is about prisons, state prisons. since the county's been kind of involved with the skilled nursing facilities, I'm wondering, does the county public health department have any involvement with the state prisons? I know that some are seeing outbreaks, and just wondering if there's any coordination or involvement there.
Thanks, Stacy. We're trying to find you an answer. While we're working on that, did you have any other questions?
Yeah, my other question was that there's been in excess of 100 new cases reported daily every day in the past week except for one, and on 8 out of the past 11 days from what I can tell. And I just wondered if there is an understanding of why that is. It's a pretty significant increase happening over a pretty steady period of time now. Is it possibly related to Memorial Day weekend? And this is sort of, a lagging indication that there was more spread that happened than we thought. Is the contact tracing illuminating anything in terms of why there's so many more new cases?
So we're going to have Kim respond to that, Stacy.
Hi, Stacy. To answer your question about the prisons, prison cases are indeed counted in our Kern County numbers. We also, public health is responsible for following up with any staff members if they live in Kern County. Obviously, we do have a number of prisons that have a number of staff that live outside of Kern County, and it's the county of residents that follows up with those individual patients. We support the prisons and are in discussions with them about persons who are being released who may be positive. We have given and work with them on guidance about testing and help them manage what's going on in those prison facilities. They obviously have their own support system through the California Department of Corrections and Rehabilitation, but at a local level, we are in talks with them pretty regularly about any identified positive inmates as well as identified positive staff. Stacey, will you repeat your second question for me? Sorry.
Sure, no problem, Kim. The question was that we've seen more than 100 new daily cases being announced or reported over the past week. It was every day except for one, and in the past 11 days, it's been 8 days that there have been over 100 new cases reported on a daily basis. And I was just curious if you are aware of any reasons for this pretty marked increase in the number of daily cases, whether it goes back to Memorial Day weekend, perhaps, as some other counties believe, or if any of the contact tracing has unearthed, a possible, means that it's spreading anew in certain areas or in certain ways.
Certainly. This is something we've all been interested in, as well as at a state level. If anything like Memorial Day weekend, 4th of July weekend we just had contributes. What we have noticed in our contact tracing is that we do have a number of people who identify non-household contacts, of people who they are in close contact with outside of their home. So we know that people are gathering. We haven't identified a large community event per se, but that people, as they are interviewed, they mention, they visited someone or they had people over to their home, and that, expands our contact tracing. But we do see a large number of our patients who identify non-household members of people they have been in close contact with, not only during their incubation period where they might have been infected, but also during their infectious period as people that they may have infected by being in close contact with while they're infectious. And so those are the groups of people that we are very concerned about. And that we want to remind people to limit as much as possible the gatherings you're doing outside of your household, because that does increase the risk of you coming in contact with someone, or that if you are, or if you become positive, it increases the risk that you pass that infection to others. Thanks, Stacey.
Okay, thank you.
Okay, that was our last outlet. Are there any other follow-up questions from anyone on the line?
Quick follow-up question, Kylie Walker.
From Channel 29.
Sorry.
Kylie, go
and
ahead.
it's kind of about, It's about the strike teams. Have any strike teams here in Kern County issued any citations?
So we're not aware of any citations. That, we'll have Matt try and respond.
Okay.
Sorry about that. So the state, nor the strike team, they have not made any contact with us locally yet about their actions. I think we have read an article or two where they were active in the county, but we have had no firsthand contact with them yet. In fact, today, we were going to ourselves try to make contact with them to try to get an understanding of how they're prioritizing. Are they active in Kern County? What are they doing? But to this day, we've had no contact.
Okay.
Okay, and I think I might have heard Channel 29 chime in there for a second.
Hi, yes, this is Kyra from 29. I had a quick question I wanted to just bring up. I thought this was interesting. We got word that there were a few glitches at free testing sites, specifically in Wasco. A gentleman said that he got his results before even having his appointment. Is that something that you've all heard of in recent weeks? Is that something people should be aware of, or something in the system they're trying to work out right now?
So we are aware that there were a couple of glitches. They were very few in number, and we isolated that with the testing provider and have determined what happened and reached out to those individuals. But we are not aware that there's any more of that happening or that it was even remotely widespread.
All right, thank you, Megan.
Any other questions?
JR, Kern Radio.
Go ahead.
Yeah, you said you haven't heard from the governor's office or the strike force, but on your call this morning, did you specifically ask if there are strike forces teams in Kern County, or did you ask specifically for them to send strike force teams to help enforce the guidelines?
We'll have Matt respond.
Good morning. So this morning we were speaking to the California Department of Public Health, their licensing and certification branch, as it relates to regulation of skilled nursing facilities. We have not yet talked to the governor's office or the California Department of Public Health, or I think it's CalOES, California Office of Emergency Services, that is overseeing the strike team. So we've not yet had conversations. Our hope is this morning or today, we were going to try to initiate that on ourselves so that we could get some clarity. Hopefully that answers your question.
Do you plan on asking to bring a strike force team to Kern County?
Our role right now is to understand what their objectives are and what their abilities are and sort of how they're going to decide where they're going. Again, I have no information, so I don't think the county has that role, but we're certainly going to ask how they determine where they're going to spend their time.
Okay, last call. Any last questions?
Hello, can you hear me?
Go ahead.
Hi, this is Elizabeth again from Kernsel. I just had a clarification question on the ICU beds. You said the state reported 67 patients are currently in ICU. Is our capacity 78 beds in Kern? Is that right?
78 ICU beds. Are you asking the total number of ICU beds in Kern County?
Yes.
So we'll have to actually look that number up. From the 10 acute care hospitals, there are a number of beds, but we'll have to get that number back to you.
Okay, should I email you then?
Yep, just send either myself or Michelle Corson an email, and we'll get that number to you.
Okay, thank you so much.
Any other questions? Okay, that concludes our Monday COVID-19 briefing.